Hello, today we are going to learn about drugs for cardiac failure. So, what do you mean by cardiac failure or heart failure or congestive heart failure? It's an inability of heart to pump out blood to meet the metabolic requirements of the body. And CCF is older terminology used for hedematous state. Then in heart failure or cardiac failure, right and the left ventricles will be failed to function. Then if left ventricles are failed, then pulmonary edema occurs. If right ventricles fail, then peripheral edema or hepatomegaly occurs. The clinical features of cardiac failure is peripheral edema, hepatomegaly, then pulmonary edema, fatigue, and sinuses. So pathogenesis, as we mentioned, heart is failed to pump out the blood for getting the metabolism of body and characterized by the reduction of cardiac output and increased PVR. So next, coming to the point, we will look up about the treatment options. So first of all, inotropics is the drug which helps in the increased cardiac output. Then vasodilators are the agents which helps in the reducing peripheral and pulmonary vascular restrictions. So vasodilators are the agents which helps in reducing pulmonary and peripheral vascular restrictions. Then comes next drug is diuretics. Diuretics are the agents which helps in the reduction of edema in the limbs or in the body parts. So classification. First of all, diuretics. Diuretics, like we have, there are three classes: loop diuretics, thiazide diuretics, and aldosterone antagonists. These three drugs are mostly commonly used for cardiac failure. Next comes vasodilators. Vasodilators are again classified into three groups: mixed vasodilators, venodilators, and arteriolar dilators. So in mixed vasodilators itself, there are again two more class of drugs, that is AZ inhibitors and ARBs. Next comes inotropics. Inotropics again classified into three: cardiac glycosides, then phosphodiesterase inhibitors, then comes beta agonists, and their examples are also mentioned here. So first we will go through about the cardiac glycosides. In cardiac glycoside, digoxin is one of the most commonly used glycoside for cardiac failure, and secondary digitoxin and obion. Then comes about the sources. So they are digoxin and digitoxin comes from the digitalysis group. Next, obion comes under Sulfandus glandus group of drug. This comes under that particular plant. Then digoxin is the prototype drug. Means it's a first line choice of drug for cardiac failure. Then MOA means mechanism of action of cardiac glycosides. This is just a means pictorial explanation about cardiac glycoside. So it inhibits the sodium potassium ATPase pump present in the cardiac cells. Then, as a result, increase the concentration of sodium in the cell, and due to the increased sodium levels, sodium calcium exchange function is got reversed, and it's sodium calcium channel exchange is a normal function. That exchange will get reversed. As a result, sodium will go out of the cell and to exchange calcium. Okay, sodium will move out in place of calcium exchange. Okay, then comes more entry of calcium in the L type calcium channel. So in calcium channel, more entry of calcium ions. As a result, triggers the release of calcium from the sarcoplasmic reticulum and increases myocardial contractility. So actions of cardiac glycosides. They will act on cardiac as well as non-cardiac or extra cardiac actions are available. So cardiac actions, they will increase the force of contraction and increase the cardiac output. Then systolic shortened, then more time for ventricular rest and refilling. Then it decreases the heart rate due to the vagal stimulations. Why digoxin is a cardiotonic drug? It does not significantly increase the oxygen demand, but due to the decreased heart rate and ventricular size, thus improves the ventricular performance without increasing the oxygen demand. So comes to the extra cardiac actions. In kidney, they helps in the diuresis due to the improved renal perfusion, and which helps in the reliefs of edema. Then GIT, nausea and vomiting due to the chemoreceptor triggering zone stimulation. Then areas of digoxin. So cardiac side effects or areas are bradycardia, then ventricular fibrillation, then fatal cardiac arrhythmia, and extra cardiac areas in GIT, what nausea, vomiting, and diarrhea. Then comes CNS, blood vision, headache, visual disturbances, and hallucination. And digoxin is one of the narrow therapeutic index drug. So if a patient got what digoxin toxicity, what are the measures we have to follow? First of all, stop digoxin, then stop diuretics because they can cause hypokalemia, and we have to start with the oral or parenteral what potassium supplements, then give IV propranolol and IV lignocaine, and to what compensate the ventricular arrhythmias. Then we have to, if the case is so severe, then we have to start with what digoxin antibodies, that is digibind actually, it's digibind. In severe cases we can, serious cases we can use digibind as a what digoxin antibody to neutralize the circulating digoxin. Drug interactions of digoxin. in which of the conditions the digoxin toxicity may increases. So when digoxin is given with diuretics, which results in the decreased calcium, potassium levels in body, as which results in the increased digoxin toxicity. So next when verapamil and tetracycline is given with with digoxin, which displaces digoxin from the protein bind site and increases the toxicity of digoxin. So in which conditions digoxin effect may reduces, and does it? And also it reduces absorption of digoxin, which results in the decreased digoxin's effect. So enzyme induces, when digoxin is given to the enzyme induces, they can increase the metabolism of digoxin, and which results in the decreased digoxin effect. So cholestyramine and digoxin given together, they will cause decrease in hepatic circulation, which results in the decrease in digoxin's effect. So uses of digoxin in cardiac failure preferred in the low output failure due to the hypertension or ischemic heart disease and arrhythmia. So slow digitalization, then cumulative effect and narrow therapeutic index leads to the cardiotoxicity. Hence, slow digitalization. Plasma concentration 0.8 to 1.2 mg per ml. Then digitalizing dose 0.5 to 0.75 mg 8 hourly for total 3 doses orally. Then maintenance dose 0.25 to 0.5 mg per day can be given. So rationally of digoxin in cardiac failure. So what digoxin will do is nothing but digoxin increases the force of contraction and increase cardiac output, which results in the improvement of what tissue perfusion, then as well as the increased cardiac output and results in the increased renal blood flow, which helps in the diuresis or which enhances the diuresis and relieves the edema. I will not end digoxin will not reverse the pathology or cardiac arrest that is going to progress to cardiac failure. Then uses of digoxin in arrhythmias we can use arterial fluttering and atrial fibrillation, and depress the AV nodes by vagal stimulations, then decrease AV conduction velocity and prolongs the EPR, effective refractory period, which stands for EPR. Then PSVT, that is proximal supraventricular tachycardia, slows the conductions through AV node by vagal stimulation. Then rationally of loop diuretics, furosemide or loop diuretic, which helps in the excretion of sodium and water, which helps in the reduce the extracellular fluid volume and results in the decreased preload, improves ventricular efficiency. Then if extracellular fluids are reduced, then relief from the peripheral and pulmonary congestion in edema. that provides only symptomatic relief in cardiac failure.